Hello, I am Dr. Prahalad Rao from Mysore. Today I am going to talk about diabetes mellitus for general public. Diabetes is a progressive metabolic disorder. As such, it is not a disease. When it uncontrolled because of the high glucose level in the blood, it may cause severe infections, fungal infections, and even retinopathy, nephropathy, and cardiac diseases. Usually the patient comes for some other problems and even urinary infection, balanitis, or frequent skin infections, cellulitis, like that. And when we do the blood test, they came to know that they are having diabetes because of the high blood glucose level. Mainly, there are three types of diabetes mellitus. Type 1 diabetes mellitus, wherein they lack the production of insulin, and the treatment is they require insulin to reduce the blood glucose level. No other medicine will help. Type 2 diabetes is age onset diabetes, and it can be controlled by doing diet and exercise in early stages, by giving oral hypoglycemic agents, and later on, if not controlled, we can add insulin also. Another is gestational diabetes. That means many pregnant women will develop diabetes when they are pregnant. So once they deliver the baby, the glucose level will come down, but they are prone to develop diabetes in their later life. During pregnancy, the placental hormones interact with the insulin and they cause reduction in the glucose uptake by the cells. To the risk factor, the first and foremost is obesity. That is the problem of present day civilization because of the lack of exercise and wrong processed food. Physical inactivity, sedentary life, stress, and even genetics, smoking, hypertension, hyperlipidemia. These are all the risk factors for the diabetes to develop. Coming to the symptoms, it is said earlier polydipsia, polyphagia, polyuria, and many people may not get these symptoms in early stages. They will get some urinary fungal infections or frequent skin infection. When we do the blood test, they will come to know that they are having diabetes. In advanced untreated case of diabetes, there will be some amount of weight loss, dry skins, clammy skins, etc. When there is hypoglycemia, they will get cold skin, dehydration, small breathing. That means they will have fast and deep breathing with fruity smell because of the ketoacidosis. Sometimes electrolyte imbalance will occur that results in vomiting, lethargy, confusion, etc. I am not going in detail about the blood sugar levels, HbA1c, and treatment of diabetes. What they have to do is mainly when they are diagnosed with diabetes, they have to approach a doctor once in 3 months, get their fasting blood sugar, postprandial blood sugar, and HbA1c. Once in a year, lipid profile, thyroid profile, liver function test, everything should be done to monitor correctly. Foot care. So for diabetes, it is quite common to get the cellulitis and trophic ulcers, gangrene, etc. So they have to keep their food very clean. They have to observe it daily. They have to wash the interdigital space and keep it dry always. Wear a comfortable shoes, not undersized or oversized. And whenever they wear a new shoe, it is better to smear some coconut oil or other cold cream to the foot and then wear it so that it avoids friction. So frequently they have to test their soul themselves if there is any ulcer or redness or hardness, that is callus, that should be taken in the early stages itself. It is always advisable to wear closed shoes, comfortable shoes, rather than the chappals and open shoes. Many a times diabetics will have numbness of the foot, so whenever they walk on the barefoot, particularly in summer in some temples, they will have blisters, and that will turn to diabetic foot and gangrene also. Many a time it will end up with amputations. Proper nail care also should be taken. Particularly female, they should not apply the nail polishes, which may cause brittleness of the nail and uh, infection, fungal infection, everything. In general, I advise all of my patients to go for regular checkup, annual checkup once in a year after 30 years. When once they are diagnosed with the diabetes, they have to approach the doctor once in 3 months for regular biomedical tests and monitoring the diabetes. Annual eye checkup is a must, and whenever they have got some illness, they should be very careful. During stress also, they should be very careful because during that period, blood glucose level shoots up. So without the advice of the doctor, don't stop the medicines. Always stick on to their regimen. If there is any complication occurs, immediately you can approach the doctor and they will tend to change the type of medicines also. Drink plenty of water, consume lot of vegetables and fruits, lesser of the carbohydrate, no sugar, no jaggery, and too much of sweetened dry fruits and mango, jackfruit, that thing should be avoided. And protein supplements in the form of nuts and cereals, whey protein is advisable, particularly for elderly patients, because otherwise they may go for sarcopenia, that is muscle wasting. With this, I will conclude my speech. Thank you.